behind them. I invite Dr. Kwesi and Dr. Nivedita on stage. Is Dr. Kwesi? So Dr. Nivedita Patil is a consultant ophthalmic surgeon who practices medical ophthalmology, anterior segment surgeries, contact lens, fittings retina laser, fundus angiography, and YAG lasers. She has worked in various hospitals, including Red Cross. And I'm sure we already know Dr. Kwesi. So please give a big round of applause for them.
Hello, everybody. Good morning. Kwesi will start with the presentation on MetaVision because he's the master. I'm very, very new to MetaVision, just 40 days exactly to be precise, because I did a course basic with Anu last month. And thank you so much, Anu, for having me on board. It's been a privilege to be with the masters. I'm a learner. I'm learning a lot. So it will be he guiding and I shall give my inputs. Thank you.
So I am sharing with you about the eyes and connection to meta health. And the most important is what Stefan yesterday said. Normally I don't need to sit here because all you need to do is to connect your eyes to the source where the light comes from, and then you will receive everything you need. Normally I don't have to talk, because you can experience everything on your own. And because our lives, we have designed them like that we are not in connection with the prime source of our being, we need to learn from each other to get to that prime source. And that's what I'm sharing with you. What I always do in every course is also to illustrate the invisible. Because Ute heard from Germany, she showed a video in her talk that she had, and in the workshop. In the evening, it was about quantum physics. And they said that 1/1,000,000th of what is in the universe is matter. The rest is no matter. And even what we perceive as matter is an illusion, because it's just a frequency that occurs as matter. So what we are seeing is the refraction of what is really there. Colors is when we cut the light in different aspects. So the first thing we need to understand, even if I see something with my own eyes, I have to be aware this is just an illusion. And we have created a collective illusion where we've got some rules, and it's a game. So what Rob said, we should have fun here on this planet, and we should be playful and not so serious, because seriousness is a killer. And I quote Jasmina again, because Jasmina, when she talked yesterday about Dr. Grabovoi, he's a master of numbers, mathematician, a genius. And numbers are what we use to create. So creators communicate in numbers. And we are very honored to have two colleagues here from Egypt. This is the eye of Horus, the eye of the intuition. And the Egyptians, or whoever lived there, they built the pyramids. Up to now, we don't know how they did it, and we can't do it, because they were master of numbers. So I will come to the numbers later, because we've also got the numbers in our eyes. And when we talk about the eye, we have to always remember that the retina, where we receive the light, is already part of the brain. So we are literally seeing with our brains. And light is more than seeing. Light is energy. And the energy can be as a wave, or it can be a particle. That's what quantum physics knows. And how it occurs to us as a wave or a particle depends on how we communicate with the light. That is our choice. So Rob just talked about doctors, and you saw this quote already, that doctors are men, also women now. In the past, they were mainly men, who prescribe medicines of which they know little to cure diseases of which they know less in human beings of whom they know nothing. Now the rescue is the patient is the doctor and the doctor is the assistant. So who does not know? The patient is the doctor and the doctor is the assistant. So they both don't know. Lack of self-knowledge and lack of orientation. How many of you, when you meet somebody, also here in India or other places of the world, they ask them, how do you feel? Normal? Normal question? How many of you have experienced that somebody comes and says, how do you see yourself? Have you ever heard that? Anybody ever asked you that? Okay, no? Good, then go to your neighbor, find a partner, and ask him, how do you see yourself? And then wait for his answer, and then switch. Okay, please do this exercise. Try to be short and precise in your answer with one sentence. How do you see yourself? How do you see yourself?
Slim.
One word, very precise, wonderful. Then please switch. Okay. Devoted to life. How do you see yourself?
As a healer.
Good. So, isn't it interesting that the eyes, out of the 5 senses, is the most important? About 70% of the brain activity is engaged in processing the information of the eyes. And we hardly ever ask us this question, how do we see ourselves? So we are blind about ourselves, and that is what I mean with spiritual blindness. We don't know what we are, we don't know who we are, we don't know where we are going to, and we don't know where we come from. We are in collective amnesia. But there is hope, there is light. Yes? Exactly, it's enough, and that's why we don't want to see. Very good. Now we go in the eyes, and it was mentioned we are going to give you some knowledge, some experience that I have got out of the observations, and I acknowledge every client with whom I ever worked. I acknowledge every colleague, a medical doctor or a mental health colleague, whoever shared with me, because from everybody I can learn. From everybody. And especially I acknowledge my daughter, from whom I learned the most. So, and my mother. And my father, because my father said, my father said the highest principle in heaven is there's a cosmic order. And now we go into this order, and we will start with one very simple, it looks on the surface simple, this order, that maybe a lot of you have seen yourself or had it yourself or with clients, conjunctivitis. Yeah? So who has ever had in the room here some issues with the eye, conjunctivitis? Okay, yeah? It's not pleasant. You get a red eye, a pink eye, it can pain, tearing. And those of you who've got a meta health training, you know it's the same pattern like the epidermis, the outer skin. So what is behind it? It's a visual separation. And you get this when you are visually reconnected. That's all you need to know. So this one is in second phase when you've lost somebody out of sight. The kid goes to the kindergarten the first time. It wants to still be with mama. Then the kid comes home from kindergarten, sees mama again, and red eye. Oh, some kid in the kindergarten must have an infection in the eye and my poor child got infected. No. The child loves the mother, is attached to the mother. And because the connection was not there, and when he touches the mother again, then he reacts. What is behind it is that the person thinks, has got the self-image, I can only be in harmony if I see that person. So the lesson is emotional independence. When I'm in harmony with myself, even so I am disconnected to somebody I love, I can still feel being disconnected, but I can still be in power and in my own harmony. And when I'm in my own harmony, then I'm again connected with that person. So this is about emotional independence. Very easy. So now let's go to something that is very common in Germany, that is retinal detachment. So, dear colleague, I'm so happy that now I have a colleague, an eye doctor, with whom I can share. Yeah? I was so enthusiastic when I met you the first day, that was Tuesday evening.
I guess the feelings are mutual.
And how common is retinal detachment? Do you see it often here in India?
Yeah, we do see a lot of detachments.
Okay. So you want to know what is behind it? Anybody here in the room who has it him or herself? Or do you have relatives or clients or friends who had it? Okay, a friend. Good. Yesterday in the workshop about the writing, it was fantastic. Because just three aspects. First, it's about communication, clear and simple and brief. So clear and simple and brief, what is behind it? If you are attached to something, and you can't let it go, your body will tell you, let it go. This is attachment. And when the vitreous body tears on the retina, it's telling you to let go. A woman who was attached to her husband, and the husband in Germany told her, oh, I've got a lover, and I want to stay with the lover, and I want to stay with you. All of a sudden, he told her one day. Then the woman said, okay, I'll stay with you. That were her words. She got retinal detachment. So what did her body tell her? Her body intelligence? Let go. And because she didn't let go and she was attached, she got the retinal detachment. So if you've got people with this, always identify where in their life they are attached and they can't let go. Very easy and simple. This is how you can treat it in the medical conventional context with laser. Inflammation of the iris, iritis, very painful. Yesterday, Dr. Bader and Jasmina talked about pancreas tumor, brainstem. Iris is brainstem. When you've got somebody with iritis, it's always the context with work and money also. And this is also in second phase. This is again traction. You can also have it on the macula. Yeah? And then you get macular edema, also again attachment. Look at the images, because image, Greek, means idea. When you look at the image, it's giving you 80% of the information. Here you see the attachment. One-to-one translated from the body to the mindset and the emotion. And now we come with the corner we do later. Now we come to the retina, macular degeneration. Also very simple. When you've got macular degeneration, it means the tissue in the macula, the cells, with those you see, they're being destroyed. Cell minus, cortex. And when you can't see, it means there is a visual displacement. You just said, enough, I don't want to see that. Exactly that is happening with the macula. A person who betrayed a partner was afraid that this is going to be outed. They will find out. And the person was ashamed, oh, what did I do? I don't want myself behaving like a sinner, and I don't want other people to find out, so the person developed macular degeneration. I don't want to see it. Macular degeneration, you can't see it anymore. Yeah? So the emotion connected to the macular degeneration is shame and guilt. One of the deepest negative emotions that we human beings have. Shame and guilt. And when it becomes wet, then there's also the fear of death, because that is brainstem choroid. So we just go into the diabetic retinopathy, and then we come to the case. So diabetic retinopathy, we have to do with the blood vessels. Diabetes, people who have the background for mental health, they know what it's about. Yeah? This disgust, resistance, and Dr. Bader said that it's not clear from conventional medicine, why do people get the microangiopathy? Why is it that the blood vessels suffer with the blood sugar? The explanation that we have learned that the high blood sugar is affecting the vessels does not make sense, because not everybody gets it. And we from mental health know that with the blood vessels there is a specific, distinct conflict that has to do with identity. Blood identity, very simple. So a person who has got a disorder of the vessels of the retina has got a context with identity and seeing. A woman who identified with the eye and who was diabetic had a tree that she loved, and this tree was cut. And because she identified with the tree and the tree was cut, she developed diabetic retinopathy. Before 30 years diabetes, no problem with the eyes. She identifies with the tree is cut, her heart is bleeding because the tree is cut, she develops diabetic retinopathy. So find out where is the conflict in context of identity when it comes to diabetic retinopathy, because it's the blood vessels. And to make it very easy, brief and clear, blood vessels, identity. Inferiority complex in context of identity. And now we are going to see a wonderful case presented by our dear colleague of Mumbai. Is it on?
Yes. Which one?
This one is forward.
So we are going to present a case study about one patient who came to me last month in January. And it's a case of anterior staphyloma. So as we go ahead, I'll tell you what it means, and I'll just give you the background. A 26-year-old male comes to me in January 2017, complains of loss of vision in the left eye. He came with complete loss of vision. He had pain, redness, watering, burning since September 2015. The history he gave me is he had a fungal corneal ulcer, which was detected very late. It got missed initially. Then there was a corneal graft which was done, but the graft failed. And because of the failed graft, which became weak over the next few months, it got vascularized, and finally there was a formation of an anterior staphyloma. Now what is an anterior staphyloma? It's a bulging near the anterior pole of the eyeball. This is how he came to me. Day one, when I saw him, this is how he was. I gave him some antibiotics and some lubricants, and I called him back the day 2. And day 2, when he comes, we can compare day 1 and day 2. The congestion has gone down. The staphyloма looks to be little in control, and symptomatically he felt better. I called him the day 3. The symptoms were relieved. He was very comfortable. The complaints of pain, watering, redness, he seemed to be pretty comfortable on day 3. So I called him after a few days. So when he came back to me after a few days, his condition had worsened. The protrusion had increased. So we have day 1, 2, 3, and after a few days, if you can see the 4th slide, the protrusion is much more than what he came to me on day 1. His vision was faulty perception of light. We did a B scan, which was an abnormal scan. And we finally took a decision that his eye needs to be eviscerated because it was not a functional eye, it was a painful eye. So evisceration means removal of the eye contents, leaving the scleral shell and extraocular muscles intact. So why eviscerate? The decision we took to eviscerate is to end the pain and other symptoms, to prevent the brain and other eye getting affected because it was an infected, inflamed eye. It can go to the brain, it can go to the other eye, so we wanted him not to have any further complications. Also to improve cosmosis in the blind eye. The ectasia, it looked really pathetic because he came like that. He would come to my clinic and everybody would be, oh my God, what is this guy got? Including my receptionist, day 1 came running and said, this horrible looking eye in the, I said, yeah, but you are not supposed to react like that. You are in the eye doctor's clinic, okay? So I would be always taking him first the moment he came in because I didn't want for him it to be a social, embarrassment. Then also we decided to eviscerate because of social acceptance, and we decided to give him a false eye later. Post-operatively, this is how he looks. Now comes the interesting part. The meta health, we given the background. So meta health, as we all know, it is the interconnectedness of body, mind, and the social environment. It's about understanding the stress triggers, the emotions, and the belief systems. It's about getting to the root of each disease. Meta health is about proper diagnosis, preventions of recurrences, and thus healing oneself, and not just becoming symptom-free or finding a quick fix. So let's retrospect what happened, what went wrong, and where for this patient. Let us look at his conflicts. Academically, he was not so good. He had failed a couple of times. He had a breakup which affected him big time, though he was dating this girl only for a 1-month period, but he carried it for years together. He was bullied in college by a senior for money. His brother went to Australia for work 5 years back, and he had a sense of separation. He was very low on confidence and had a passion for singing, which he could never pursue because his parents said singing is not going to get you anywhere in life. You better get some career. So Dr. Kwesi, let's investigate. This patient is left-wired, his affected eye is left, and you have the astro details. So what do you have to say?
So thank you very much. I first have to acknowledge Dr. Nivedita because she is very precise in taking the history. Before she got to know meta health, she said, I have to know everything as much as possible about the client, because her intuition told her this is going to tell what it's really about. So what we can say is that the cornea is cerebral cortex, and if you want to understand why a person has got a disorder on the organ level, understand the function of the organ, because it tells you everything why it's a dysfunction. The cornea is the transparent window that breaks the light so that we can see. So the cornea bends the light, has optic function. That's very important. The cornea bends the light. The other thing is that the physiology. Has any one of you, is anyone wearing contact lenses here? Yeah? Did you ever had problems with the contact lenses on the eye? Yeah? Everybody ever had a foreign body in the eye? Some sand or something? The cornea is the most sensitive outer skin that we have. And if you've got an issue with the cornea, it's very painful. So pain. So the cornea bends the light, and the cornea has to do with severe emotional pain because of a visual separation. severe emotional pain because of a visual separation, cornea. And there were two aspects. First, the brother left to Australia, and the brother was like a father figure. And second, he had an encounter with a woman that lasted for some weeks, for 1 month, but he put a lot of emphasis inside, and then the woman said no. And he even hid it. He didn't talk to anybody about it because he was shocked. So Dr. Nivedita learned from Anu not only meta-health, but also the Lucia color test. And within that 1 month that you know about Lucia and meta-health, she already started taking the tests. And what she found out is that this person in the test, he preferred the color orange, red, and magenta. And he rejected blue and green. And to prefer magenta and orange, red means he is longing to connect to somebody in the spiritual and also in the physical context. He is longing for love. And out of the Lucia test, and we can deduct that, or hypothesis, that he is longing for somebody because he got this visual separation from the woman who said no. And since then, he was shocked and he didn't encounter with another lady. So when we look at all this severe emotional pain because of the visual separation, and then the fear, if I'm going to talk to somebody again, I'm going to be rejected again. So he didn't do that. The other thing is that he rejected his own uniqueness because he loves to sing. But he went in a complete different direction because he was told by his father, as a singer, you can't make any money. So what did he do at the beginning?
He dropped his singing practice and he didn't pursue it. He was going to some teacher and then he didn't continue, nor did his family encourage him to take it up. Okay, so then now he went for some function somewhere and he happened to sing, and the audience was so impressed, and there was a music director, a film director in the audience, and after that they came up to him and they said, look, this is our cards, you are singing for our next film, and you have to. He said, yes, I'm undergoing an operation tomorrow. He said, yes, get everything settled and we are giving you a break. So he's so happy and excited about it.
So this could have been prevented that he lost his left eye. Yeah? Left-handed, left eye partner. The right eye for man is the eye of the will, and the left eye is the eye of the intuition. He did not follow his intuition. He did not follow the passion. And in the astromedical constellation, it was clear that why he lost his eye is because he did not follow his passion. That's a constellation of the planet Pluto and the planet Moon for blindness. And he has this constellation. And with the timeline, you can see that it absolutely fits to what he had experienced. He got affected on the eye because in his birth chart he had this predisposition. And like Rob said, doctors just make a cut of one aspect, one time in life, minimum. And then you get labeled, you have got this. We do the same thing on an unconscious level because our birth chart is just a snapshot on the time and place we were born. And because we are fixed, and we don't think that we can transform, we think we just have to stay the way we were born. And that's why we are facing these challenges. We are here to create new possibilities. Everyone has an individual starting point. It's just a starting point. And that what is in this starting point wants to be experienced. And then we can let it go. And if we don't go in this experience, the information, hey, this is what you have to experience, follow your passion, gets stronger and stronger. And for this man, it was so strong that it told him, you are blind to your intuition. So his left eye got blind. And now that the eye is being operated and he went to sing, some film producers, oh, we like your singing, come join us. They met by the possibility for you to join and sing in the film industry. So now it's happening. And we can just hope that he is now going for it, no matter what people tell him, that you can't make a living out of it. Follow the intuition in your life. Then you can create new possibilities. And out of limitation, you can create inspiration. That's the message for everybody, so we can be thankful for the experience of this person, because it's illustrating, follow the intuition in your life. That has to be the main objective. And if you don't know your mission, if you don't know who you are, what you are, where you're going to, open your eyes for the sun. The sun is going to show and to give you everything you need. And that it is possible to look direct in the sun. Some of you experienced it this morning. And I also did it after overcoming my fear. It took me 18 months because I was so conditioned as an eye doctor. So we are in time with the academic 15 minutes. And I'm an academic. So first of all, you have now in India a bright, wonderful eye doctor who has opened up for Meta Health. She has got her own clinic and she's working in 2 other clinics. I said you're working like a German. And we are going to start to do research.
Yes.
Like Rob said, the clients and the other colleagues, they want data. And I was longing so much for this, to have a colleague with whom I can share and with whom I can start making research. So Anumeta, thank you very much for connecting us.
Thank you so much.
Thank you, Dr. Nivedita. Thank you, Dr. Kwesi, for great learning about eyes. Now it's time to enroll for post-conference workshops. We all have this pamphlet with us. On the last page, you will see various workshops which is happening on 20th, 21st, 22nd, and 23rd of Feb. So please grab the opportunity, register for the workshop. Our registration desk is right outside the door. Now we break for tea break for 15 minutes.